Because CBT isn't working, that doesn't mean that therapy doesn't work. Therapy does work.
Cognitive behavior therapy, or CBT, is the most commonly used therapy for depression. As a psychiatrist for many years and as someone who has taught psychiatry in medical school, can you explain to us what do we say to someone who has found that CBT doesn't work for them?
Well, experts have never claimed that cognitive behavior therapy is 100% effective. Research has shown that the effectiveness rate or range varies from 50% to about 70%. And this tells us that cognitive therapy is not for everyone. There are other therapies. Treatment is available, effective treatment, and it's a question of matching the depression a person has with the right type of therapy. Because CBT isn't working, that doesn't mean that therapy doesn't work. Therapy does work.
So how do you explain this range of between 50% and 70% response rate effectiveness? It seems that some people are doing better with CBT than others. How do you explain that range?
Again, I would say it reflects that the patient and the therapy has not been properly matched. Therapy must meet the needs of the patient. People are different, people are unique. For example, a depressed person coming from a regular middle-class background faces challenges that are very different compared to a person who comes from a background of financial hardship, social hardship, multiple stressors. In our community, we have people coming from many different backgrounds. Indeed, if you look at a community, you have male, female, young and old, people coming from different cultures, different ethnic backgrounds. And this will reflect the diversity of experiences that the therapist, the psychiatrist must deal with. And we tailor the treatment to meet the needs of the patient.
So I wonder if an older person, for example, someone 50 plus, would respond to CBT. And I ask that just because they have had, more years to become sort of fixed in their thinking and their life situation. So how does it work for 50 plus folks?
On the one hand, they may be more rigid in their perspective and their lifestyle routine. Yet on the other hand, look at the successes they have achieved. Look at the adjustments they have made. And so CBT is successful in older people, but we must plan the CBT taking into account the person's age and the person's life experiences and personality. So a 50-year-old person has the advantage of maturity that a 20-year-old person doesn't have. And that improves their capacity for insight and their ability to comply with treatment. And all of these factors come into play in successful treatment.
So if I'm one of the people who has not responded to CBT, one of the 30 to 50% who have not responded to CBT, and I'm still depressed, what should I do?
I think that it's important you see your family doctor or your therapist and discuss what it's been like for you to go through a course of CBT. Did it work in some ways for you? What aspects of treatment worked? What didn't work? Can you learn from this? Is there anything new that you have learned about yourself? A different perspective of your problems? Or has it uncovered issues that were not acknowledged by you?
So taking a look at the assessment and the treatment experience is important?
It is. In a way, the discussion should take the form of a reassessment of the previous treatment and a second look at your life experiences revisit childhood experiences and see if there were stress factors, abuse issues, traumatic experiences that, again, weren't fully appreciated and may be influencing how you behave as an adult, how they may be affecting your relationships, how you respond to stress, how you deal with issues at work. And then take a second look at family history. Are there genetic or hereditary factors that are important and maybe impact on your depression? And then take a second look at what's happening in your adult life. How severe is your depression? Is your depression a disabling depression, interfering with your capacity to cope with treatment, to do the work of treatment? And then we look at stress factors. How severe are they? Especially when we talk of chronic stress, which can be very destructive.
Now, are there cases where sometimes there are two things going on?
Yes, with some depressions, you can have a coexisting illness. And I mentioned alcoholism, depression and alcoholism, depression and borderline personality disorder, depression complicated by psychotic symptoms like paranoid symptoms. And we call these depressions complex depressions. And complex depressions need a comprehensive type of treatment.
And what if the reality for the person, their real life situation is very, very serious and truly overwhelming?
Yeah, reality factors so often come into play. Stress can be serious, overwhelming, debilitating. And sometimes stress factors in a person's life have no easy solutions. And we know that chronic stress can often be underestimated in terms of its destructiveness in a person's life. And also, how debilitated, psychologically debilitated the person is. Is there an issue of suicidal thinking? Are they at risk in that way? Should we be thinking of hospital admission or other forms of support?
So there can be a very wide range of factors that are at play here that may have impacted why CBT has not been effective overall.
Yeah. Mental health issues are never simple. Usually there are multiple issues. And when we're assessing a problem, we look at, and some of these things I've already mentioned, but I'll go through them again because this is very important. So, severity of depression. Is a depression a first-time experience for the person? Is this their first depression? Or is it a recurring depression or a chronic depression? Likewise for stress factors. Is this a single stress factor or a chronic stress factor? Is stress overwhelming and incapacitating? The person's personality. How psychologically robust is the person's personality? How have they coped with the adjustments in life up to the present? Social issues, economic issues. Have they received adequate treatment? Compliance with treatment. So you can see there are many issues that we have to take into account in our assessment.
I guess this all really underlines why people have to be careful when listening to others. Someone may say cognitive behavior therapy didn't help at all, when in fact you've given examples of why that may be valid in a particular case. So thank you for that. And next we're going to get into other therapy options that are available for people who have depression.
Thank you.